It means a lot to me that the values of CIR align with what we as healthcare professionals strive for with every patient encounter. Events like the Healthcare Equality Forum on Transgender Health with Dr. Maddy Deutsch are is a perfect opportunity to become more knowledgeable and responsible physicians.
So we're talking about like 1 in 200, 1 in 300. So it's probably an underestimate. But it's important enough to know that there are a lot of transgender people out there. So, you know, let's talk about, so now we kind of have an idea of how many transgender people there are. So let's start talking about some of the, issues. Why are we worried about transgender care? What is the problem? Why do we need to concern ourselves with transgender people? There's a lot of underserved populations in this country, a lot of people really lacking a lot of basic services. Why is this population important? I already told you that it's a whole broad range of people. Transgender Law Center based in San Francisco did a study of 646 transgender people in California in 2008, and this is what they found. So if you look over here on the left-hand side, they found that 33% of transgender people were denied surgery, and 27% were denied hormones. So you could see somebody saying, like, well, that's not unreasonable. Providers haven't learned how to do this stuff yet. We can't complain too much about that. That points out that we need to have more providers trained, but it doesn't necessarily, I don't know that it's a direct disparity. Okay, but 21% were denied counseling and mental health services. So that's a real big deal. If you look in this box that I put over here, the box is my emphasis added, 15% were denied gender-specific care. So by that I mean pap smears in a transgender man or prostate exams in a transgender woman. So transgender man, born female, now living as male, yes? So they saw the cervix in many cases. They need pap smears. So, 15%, so that's what, 1 in 8, 1 in 7 transgender men been told, nope, can't have a pap smear, sorry, go let your HPV percolate. So the National Transgender Discrimination Survey was kind of a larger version of the Transgender Law Center's survey. So this is a sample of 6,000 people from all 50 states and some of the territories. Half of the respondents, 50%, reported having to teach their provider about transgender health. So that's bad, 100%.